People probably recognize this. It's a stretch strap. I don't usually use it for stretching muscles or tissues, but I do use it for gaining mobility with certain joints. I use it most often if I use it with gaining knee flexion in either supine or prone, and I use it to gain extra motion with shoulder internal rotation up the back, or functional internal rotation, FIR. Oftentimes for that movement, I need some overpressure, which we can accomplish in various ways, but using a strap like this is an easy way for me to accomplish it in the clinic at least. So if I need overpressure for shoulder FIR up the back, it's either with repeated movement testing of the shoulder joint, or if we decide that the treatment for the diagnosis of a shoulder joint derangement is repeated FIR, we often need overpressure with that scenario as well. There's a specific way I use it though. If it were just a piece of rope or a towel, patients could grab it. But with a stretch strap, because of the loops, which you could also make with a belt at home, the person can put her hand through it without gripping with the muscles. And for some colleagues and myself, we tend to find better results when we accomplish that overpressure up the back without having the patient contract muscles. That more relaxed kind of scenario seems to allow us to get further into end range with more effectiveness. So all that means is that the person is putting her wrist through the strap, and then when going into functional internal rotation, it's just pulling it up as high as it will go, and then relaxing. As high as it will go, and then relaxing. And if you try it yourself, you might find that yes, you achieve more motion or more mobility when the wrist is relaxed than when you have something that you're gripping. But again, overpressure into this motion is something I will use if I need to add more force into this motion, both with repeated movement testing for shoulder joint complaints, and if we find with repeated movement testing that the problem is a shoulder derangement, which I find in a lot of patients with shoulder joint complaints, then this may be the one movement that the patient needs to fix the issue.